Okay, so good day to you, everyone. I hope you are always doing well. So today we are going to cover the topic that determines the professional future of many pharmacists, and that is the Prometric exam. Let me first introduce myself. My name is Dr. Noura Nuruddin, and I am the second Prometric lecturer at the Prodemy Academy. And our primary goal is to help our colleagues successfully pass the Prometric exam and begin their careers in the Gulf region. So we will go through a comprehensive guide on how to master the Prometric exam, including the exam syllabus and the exam variations by country. And by the end of this lecture, you will have a clear roadmap to pass this exam with confidence. Don't forget the description below, as you can see here. This is the WhatsApp number for our academy. So if you have any questions, you can reach out. So as for today, this is our roadmap. We will cover 5 main areas. First, we will delve into the syllabus and the exam variations by country, and you will need to understand how the exam differs depending on where you are applying. And secondly, we will present some study strategies and pharmaceutical calculations, and these are essential tools to prepare efficiently. And thirdly, we will feature some memorization techniques that will help the test takers to remember the information while they are solving the questions. And fourthly, we will have some essential advices and common mistakes so that we don't fail into these traps leading to failure, God forbid. Lastly, we will give you some free resources and important links, and that is important for your preparation. So let's now begin with our journey. So first, you must understand the examination for the Gulf countries are actually administered by 2 primary companies. We have the Prometric and the Pearson VUE, and these are 2 different companies. So the Prometric creates the exams for the Saudi Arabia exam, the SPLE, and for the MOH exam, typically conducted in the United Arab Emirates. And we have 2 variations of the exams in the United Arab Emirates. We have the MOH covering the Northern Emirates, and we have the DHA covering the Dubai Emirates. And we have the NHRA, the Bahrain exam, and for the Qatar exam, we have the DHP. Now, this distinction is critical, and for the Pearson VUE company creates exam for the Oman exam, and for the Abu Dhabi, the HAD or the DOH exam. Now, this distinction is critical because if you study from the SPLE materials, for example, and then you attempt to take the Abu Dhabi exam, you will be shocked by the number of unfamiliar questions, and you will be shocked by the different question distributions. So while the core scientific material is nearly identical, but how the type of the test you are attempting changes the emphasis on certain questions. So this is one of the fatal mistakes that causes many colleagues to fail, even if they studied well and even if they prepared and they know in their science, they still might fail because they are studying the wrong material. So my last tip here is that you should know your exam board and you should study it accordingly. Now, let me take you to the core topics in the Prometric exam. The curriculum is divided into 4 major topics, and these 4 pillars form the foundation of the Prometric exam across the Gulf countries. However, the exact focus and distribution of questions varies from one country to another. So the first main pillar or the first core or major topic is the pharmacology, and we call this the pharma section. And it includes familiar topics such as the cardiovascular system, the central nervous system, the antibiotics, and other pharmacological subjects. The second pillar is the non-pharmacology, or the non-pharma. We call it the non-pharma, and this category includes everything outside the direct pharmacology, encompassing subjects such as the biochemistry and microbiology. Now, the third pillar is the structure, and this is specifically referring to the medicinal chemistry and the chemical structures. And the fourth pillar is the calculations, and this section is dedicated for the mathematical problems and pharmaceutical calculations. Again, these 4 pillars are universal across all the countries, but the distribution or the emphasis on certain parts varies depending on your target country. So let's now Let's now go through each country's exam name specifically so that we do not confuse them. So again, for the Saudi Arabia, it is the SPLE. For the Northern Emirates, and this typically covers 5 Emirates in the UAE, Ajman, Sharjah, Al Quwain, Ras Al Khaimah, and Fujairah. And we have another a specific exam for Sharjah, and that is the SHA, but the OMH is valid in these 5 Emirates. And these are typically conducted by the Ministry of Health, and therefore it is called the MOH, Ministry of Health. And the Dubai is by the Dubai Health Authority, the DHA, and the Bahrain is the National Health Regulatory Authorities. And for Abu Dhabi, it is the Department of Health, the DOH. And we also have the Oman, the OMSB, the Oman Medical Specialty Board. And as we said, this is administered by the Pearson VUE, and Qatar is formerly known as the QCHP, which stands for the Qatar Council for Healthcare Practitioners. However, it has been recently updated and it is renamed to DHP MOPH, that is the Department of Health Professionals. So this slide will serve as a reference, and you need to save it if you need it later on, if you are still considering to travel to the Gulf, but you don't know the country yet. Now let's talk about the volume of questions. For Saudi Arabia, the SPLE exam features the largest number of questions. We have 210 questions, and you are required to solve 112 correct answers in order to pass. And the passing score is out of 800, and the passing score for the SLP, the minimum is 536 out of 800. And if you are a Saudi citizen seeking clinical residency, you need to score above 700. And recently, there were updates in the SPLE exam, and the number of questions was deducted to 201 questions, and the overall score became out of 600 instead of out of 800. And as for the other countries, the MOH, the DHA, the NAHRA, the DHP, they typically feature 150 questions. Now, bear in mind, a common fatal mistake is studying only from the Saudi exam materials and then attempting Abu Dhabi exam or Qatar exam. That leads to failure because, as we said, the distribution emphasis are completely different. Now, let's move to Qatar exam. I want to emphasize something critical about the Qatar exam. Qatar has recently undergone significant changes. First, the structure emphasis is now minimal. So less medicinal chemistry questions in the Qatar exam, and the structure section is now very minimal. You might find only 1 or 2 structure questions on the entire exam, or potentially none at all, depending on your exam variation. Now, the second thing in Qatar exam, they have emphasized on the dermatology sections, the ophthalmology, and the biostatistics. And thirdly, the local Qatari institutions such as the Hamad Medical Corporation and Sidra Medicine, these institutions are now tested. So you need to know about these institutions and the regulations. And ignoring such important updates can lead to failure or missing many questions. Now, for the Pearson VUE countries, including Oman and Abu Dhabi. Regarding Oman and Abu Dhabi, the structure, again, is not the primary consideration. And if it appears, it will be likely 1 to 2 questions only. And in Oman, they might not appear at all. Oman, on the other hand, loves to focus on the packaging, the disposal, and the specific type of glass used in manufacturing pharmaceuticals like the ampoules. And they have slightly different mathematical calculations. On the other hand, Abu Dhabi, they prioritize the sterilization techniques, the packaging, and the good GMP, and the regulations specific to Abu Dhabi. And we have also special regulations unique to Oman. So if you are targeting Abu Dhabi or Oman, make sure that you shift your final focus on the regulations part. So if you ask whether you need a separate study materials for Oman, Abu Dhabi, and the DHA, the answer is actually no, because the scientific material or the core curriculum is one single curriculum. The foundational scientific base is almost the same across all the countries. So you must study one unified material. This is going to be your first step. And the second step is that at the very end of your preparation, as you are getting closer to the exam date, you start solving questions and you start to pivot your focus or shift your focus to what your specific target countries emphasizes. And here is one of the crucial warnings. Studying only Qatar's updated material without the core scientific curriculum is actually a recipe for failure. You must rely on the comprehensive curriculum first, then you narrow down and solve the country-specific questions at the end. So actually, most of you might think that I just want to pass. Passing is the primary goal. However, you must study for a high score. Because as we said, for the SPLE exam, achieving exactly the minimum end of the score, which is 536, yes, it results in pass, but some people need to higher scores, especially if they are considering clinical roles. So to be safe, to get a chance in the hospitals to get a clinical role, you must go beyond 700 out of 800 for the clinical residency. That's why we always say, try to aim high, because again, you are investing significant money. You have testing fees, courses, travel, and you're working 24 hours to save for this day. So you don't want to jeopardize your investments. You study for excellence, not just to pass. Actually, one of the dangers or one of the pitfalls that many colleagues fall into is that they tell me, I studied the pharma, but unfortunately, I just don't like the calculations. I can't stand calculations, so I skipped it. So let me be very direct with you. There is no such thing such as I don't like when you are paying around $300 for an exam. By saying this, you are actually increasing your chances of failure. You cannot predict your specific exam model. You must prepare for the all cases. You must prepare for the worst case scenario. You might face an exam variation with 7, 10, or 20, or 30, or even 30 calculation-based questions. And losing around 30 calculation-based question is a massive loss, especially when you do not guarantee answering all of the other sections perfectly. So again, our advice, never neglect any part of the exam. You have to go through the 4 main pillars, the pharma, the non-pharma calculations and structure, and prepare for everything. Now, let us talk about something that is just as important as the academic content, and that is your spiritual and mental preparation. So the very first step is to ask God for success. And success always comes from God, not just from your effort. So start every day with pure intention dedicated to God, and that you will pass the exam regardless of your circumstances. So let me give you one of our real-world examples. One of our students, he graduated at the class of 2009, and he forgotten almost everything due to the time gap. He is a graduate of the 2009, and he forgot all of the scientific content. However, when he took the Dubai exam, he scored 73%. Now, the passing score for the DHA exam is 60%, and he achieved above the minimum score because he genuinely studied and committed to the process. So again, do not be deceived by the rumors that the exam is easy or purely relies on repeated questions, because while some questions do repeat, a large percentages of the exam questions are entirely new, and they depend strictly on your deep comprehension. So if you enter the exam having merely memorized the questions without understanding them, you will likely fail. Also, you must create a comprehensive study plan and schedule your time. You should not go in a messy way. So on the left side here, this is what you should not do. What you should not do is study by luck and say that today I will go through the cardiovascular and tomorrow I will casually look into the CNS notes. Now, this messy way of studying, no structure, no schedules, studying based on your mood, this leads to gaps in your knowledge. And on the right side, the right thing to do, what you should do, is that you should create a structured plan, and you should build a realistic weekly schedule, set daily and weekly goals, and allocate time proportionally to the weight of each topic of the exam. And you should track your progress and adjust things as needed. Also, you should focus on the high yield topics, and you absolutely cannot skip major topics such as the central nervous system or the cardiovascular. You must study them deeply and thoroughly, and solve extensive questions on them after you go through the lectures. Conversely, on the other hand, dermatology, for example, for the SPLE exam, the dermatology part in the SPLE or in the Saudi Arabia exam, it yields only 1 to 2 known questions. So it is considered to be a massive waste of time to abandon the CNS and the cardiovascular to study the eczema and other minor dermatology topics, knowing that they only have 1 to 2 questions. So again, you have to prioritize the most frequently tested subjects according to your exam. Now, we have some dangers of following unverified advice, and this is extremely important. Never skip the major topics based on someone else's personal experience. Here is one scenario that can happen. A colleague can claim that my Qatar exam was entirely non-pharma, acting as an expert, and this colleague advises the whole group to focus only on the non-pharma section. Now, if you follow this piece of advice and you neglect other sections completely, your unique exam model might be entirely focused on diabetes and hypertension clinical scenarios, for example, and this will cause you to fail. So the main message here is that one person's experience is not considered data and you cannot rely on it, and do not take the personal experiences of others as absolute truth. And that's why we always advise you have to study absolutely everything. Also, your resources must be highly organized. You must study from one single source. So again, on the left side, what you should not do, so this is the wrong approach, is that many colleagues scatter their attention, taking courses from multiple doctors, downloading random internet files, gathering various documents. And while they feel satisfied for having many studying materials, their brain's information become overloaded and scattered and corrupted. And when they try to recall the piece of information, they find it completely tangled and hard to recall the information. So on the right side, this is the right approach is the consolidating. So you have to consolidate into one source, and if you find extra information outside of your primary source materials, do not study from a completely new book. Instead, just write this new piece of information directly into your primary notes instead. For example, if you are studying the cardiovascular system and you find a newly discovered question or updated fact, you just write it into your main primary notes, and this consolidation is the absolute best way to solidify your information in your memory and to prevent confusion. Now, moving to the second part of our lecture, and this section is all about practical tools you need to succeed. So we will cover alligation methods and some memorization strategies and some tips that you can follow when you encounter the exam questions. So starting with the alligation method, the alligation method is one of the most important and frequently tested calculation topics in the Prometric exam. And simply, alligation is a method to prepare a specific concentration by mixing two available solutions. So consider this real-world scenario, and this is a repeated exam question. They tell you a nurse needs to prepare 450 mLs of the 15% glucose solution. However, when you look at the pharmacy shelves, you realize that the only stock you have is a 50% glucose solution and a 5% glucose solution. So the Prometric curriculum teaches you that you can easily prepare the requested concentration by simply mixing specific volumes of these two available solutions to achieve the desired solution of 15% concentration at the exact volume of 450 ml, and that is the nurse order. So when you recognize these questions in the exam, whether you are giving two concentration and asked to prepare a third one, so this is how you recognize the alligation questions. And again, this is one of the core Prometric competency, and this is not something to outsource. So let's take here an example. So to solve the alligation problem, we use what I like to call the tic-tac-toe table method, similar to the XO game. So the first step is that you want to set up your grid, and you want to place the concentration you want to prepare in the middle. So as you can see here, the target solution is placed at the middle, 15, and at the center of the table, and you place the highest concentration available at the left upper grid. So this is the highest concentration available in the question, which is the 50% glucose, and the lowest concentration, the 5%, is placed at the lower left part. And what you're going to do is that you are going to subtract diagonally across the grid. So here you are going to subtract 15 minus 5, so that yields 10 parts. So that is 10 parts of the 50% solution. And again, you are going to subtract 50 minus 15, and that is 35 parts. And this 35 parts is associated with the 5% solution. So the 35 parts is associated of the 5% solution. Now, the third step is that you want to calculate the total parts by adding the individual parts together. So 10 parts plus the 35 parts, that yields a total of 45 parts. So this is the total parts. The fourth step is that you want to calculate the final volumes. And in order to find how many millimeters to take from the 50% solution, you look at the parts corresponding to it. So here, the 50% solution, what corresponds to it is 10 parts. So that means you are going to make 10 parts of the 50 solution divided by a total of 45 parts multiplied by the total volume desired, and that is 450, and that yields 100. So you need to take 100 ml of the 50% higher solution, and you need to take 350 mLs from the lower 5% solution. So again, to know the mLs, you apply the same logic. So we have 35 parts of the 5%, so 35 parts divided by 45 total, multiplied by 450, and that yields 350 mLs. So that means you take 100 ml of the 50% container, and you take 350 ml from the 5% container, and mixing up these together would yield exactly 400 ml of the desired 15% glucose or dextrose. So this is the alligation method simplified. And just to check that your calculation is right, you can just sum up the 350 and the 100, and they should be exactly 450. Otherwise, it means that you've done something wrong, because the final volume needed is 450. Now let's move from calculations to memorization techniques. And the golden rule is to understand before memorizing. So the more you understand the concept, the more you can connect it to various questions. And if the exam changes the phrasing of a question, your deep understanding will help you, and it will allow you to handle it, unlike someone who just memorized the surface level fact. So let's take this example, which features the metabolism of norepinephrine. And if an exam asks what product is created when the COMT enzyme, and the COMT enzyme is the catechol O methyltransferase, acts on norepinephrine. So the exam question is asking if you have norepinephrine, and what is the yielded structure formed when it is subjected to COMT enzyme. And the answer is the normetanephrine. So as you can see, this is the how the question is phrased. They bring you a structure and a question, and they ask you pathway A yields what. So this is the COMT enzyme. So let's break down this question. So the COMT enzyme acts on norepinephrine, and let's break the name of the COMT. So the COMT stands, as we said, stands for catechol O methyltransferase. So it says methyltransferase. That literally means we are transferring a methyl group, and there is O. So what happens here is O-methylation. So what is O-methylation? O-methylation is basically adding a methyl group to an oxygen atom. So if you look closely here at this oxygen atom, you will realize that we've added a methyl group, and that's why we have now OCH3 here. So what happens here is O-methylation. We have added a methyl group to an oxygen atom. So the catechol, on the other hand, refers to the specific chemical ring structure, and therefore COMT enzyme simply places a methyl group into the oxygen of the catechol ring of norepinephrine, and that results in normetanephrine. So now the structure formed is normetanephrine. So comparing the MAO to COMT helps you to solidify the difference. The COMT enzyme, as we said, adds a methyl group to oxygen, and it yields normetanephrine. On the other hand, the monoamino oxidase, the MAO enzyme, the monoamino oxidase enzyme, performs oxidative deamination. And that means oxidative deamination means it removes an amino group, and it oxidizes the remaining carbon by creating a double bond oxygen. And this specific structural change results in another component known as dopiga. So look at the comparison here. Helps you to memorize things. So when you understand the mechanism, as you can see, there is no room for confusion. You just you do not memorize things blindly. You memorize things based on logic. The second memorization technique is the use of mnemonics. And while not every piece of information should be turned into mnemonic can help, and this is recommended for the complex drug classes that cause confusion. For example, captopril, every single letter in the drug captopril can represent a highly testable fact in the exam. For example, the letter C stands for cough, and that means captopril or ACE inhibitors have the side effect of causing persistent dry cough from the bradykinin accumulation. And the A stands for angioedema, which is the facial swelling. And this is the structure of captopril. As you can see, captopril features a group that contains sulfur atom or sulfur hydryl group, and that makes them also contraindicated in case of sulfur allergy. So angioedema is the facial swelling, and it's again one of the common side effects of the enalapril, captopril, or lisinopril. And the P here stands for potassium, and that means ACE inhibitors can cause hyperkalemia. They elevate the potassium as a side effect. Therefore, you have to use them in caution or avoid using them with other drugs that cause hyperkalemia. And T stands for taste, and that means captopril can cause metallic taste as a side effect or taste alterations. And this is a shared side effect with other drugs such as metronidazole and metformin. And the O stands for the orthostatic hypotension, which is a drop in the blood pressure upon standing. And the P stands for pregnancy, and that means it is strictly contraindicated in pregnancy due to the teratogenic effect. And the R is the renal, and that is strictly contraindicated in the bilateral renal artery stenosis. And the I stands for increasing the potassium and increasing the creatinine levels as well. And the L stands for leukopenia or neutropenia, and it is one of the rare side effects, but it is important. So this single mnemonic, as you can see, can answer many clinical case questions related to the ACE inhibitors or captopril. Now, the other technique is the smart association. So some facts cannot be understood logically, and you must simply just memorize them. And for this, we would like to introduce you to the smart memorization technique by creating mental associations. So consider, for example, the creatinine clearance formulas. We have two formulas. We have the Cockcroft-Gault equation, and we have the Schwartz equation. So the Cockcroft-Gault equation, this old sounds like adult. So it sounds alike, and this sound helps you to know that the Cockcroft-Gault is used to calculate the creatinine clearance in adults only. On the other hand, the Schwartz formula, the CH in the Schwartz matches the CH in the children, and that means you use this equation to calculate the creatinine clearance for pediatric patients or for children. So these type of questions, you don't need the math, you just need to identify the correct formula name. So here they give you a case scenario, it's a long one, but it's 70 years old man, so that means he's an adult, not a pediatric, and therefore the right answer is the Cockcroft-Gault equation. So once you finish studying the individual materials, you must go to the full mock test exams to practice your knowledge. And the purpose of the mock exams is to stimulate the exam environment and all topics mixed together, and you learn how to manage your time and evaluate your true readiness to the exam and to familiarize yourself with the question phrasing. So we have some time limits for this. The SPLA, the Saudi exam, we have 4 hours because, as we said, it have more questions, 210 questions. The Qatar, the DHA, the MOH, and the rest of the exams will typically give you 3 hours over 150 questions. So you have to allocate your time wisely. And while the longer exam is naturally more forgiving in terms of percentage, and more questions usually mean that each mistake hurts less percentage-wise. However, you still need to train yourself to maintain your focus throughout the entire duration. So let me take you to the time-saving strategy that we'd like to follow. And this is the single most important strategy that I can give you, is that always read the last line of the question first. Why is that? Because clinical cases can be up to 15 or more line long, and they can feature many unnecessary details, many lab data, and many things to irrelevant details just to disturb you. And many candidates actually fail due to the time because they read irrelevant details and they run out of time. And that's why we advise you to read the last line first and to understand what the examiner actually wants to test you. So after reading the last line, you would then just scan the text only for the data you need to answer that specific question, and this saves you immense amount of time. So let's apply this strategy on a real exam question. Here, as you can see, it's a very long case scenario, a 30 years old patient, blah, 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 so many details. So if you read the last line here closely, it tells you which of the following medications is used for treatment of MBBSs. So you know that you know what you look for. So this is the exam just wants something for MBBSs. So you start naturally to rule out the wrong option. The loratadine is antihistamine, has nothing to do with the MBBSs, so you just rule it out. The prednisone, same story. Aspirin, same story. So the only correct answer left is the Epicac. So even if you are not sure, you can eliminate the aspirin, the loratadine, as they are not anti-amemic agents, and the Epicac, or more specifically, its active ingredient, which is the emmetine, is the correct answer for treating MBBSs. So as you can see, by reading the last line, you saved yourself from reading the entire long clinical scenario with unnecessary details until you know what was being asked. Now, the third strategy is that you want to train your eyes to catch the critical keywords in the exam questions. So these keywords are often key to the correct answers. For example, if a question mentions that the patient is a smoker, smoker is a very critical keyword in the exam, and it likely means that there's an issue of drug-drug interaction. So if the patient is asthmatic, for example, or he is on theophylline and he is a heavy smoker, the smoking is actually induces the cytochrome P45 enzyme. So what the smoking does is that it induces the liver enzymes that is responsible for metabolizing the drugs. So that means smoking increases the breakdown of some drugs, including theophylline. And that means you need to increase the dose of theophylline in order for the drug to be effective. Also, the keyword African American is important because we want to avoid the ACE inhibitors in the African American race and instead prioritize the calcium channel blockers like the amlodipine due to the higher prevalence of the low renin hypertension in this population. Also, you want to pay attention to some modifier keywords such as most likely, accept, or choose the best answer. These words force you to pick the optimal choice, not just any correct answer. So let's take a real-world example. Here is a practical example of how we identify keywords. So again, here we have a heavy smoker. He smokes about 2 packs per day, and he is taking the drug olanzapine. And during routine follow-up, the psychiatrist noticed that the symptoms of psychotic behavior has worsened. So there is worsening of psychotic symptoms. So what is the cause, or what is happening, or what is the pharmacokinetic effect happening? So here the answer is that since smoking induces liver enzymes, that increases the metabolism of olanzapine in turn, and this leads to lower serum levels and reduced efficiency. So the process of elimination, as you can, or the tip of elimination, is important, as we said, when we do not know the exact answer. The process of elimination is your most powerful strategy. So here how it works: you look at each option and you eliminate what you know is definitely wrong. So you cross option A, cross option B, cross option C. So whatever remains must be the correct answer, even if you are not entirely sure why. So this is one of the important tips for any exam. And it is really useful when you can identify clearly the wrong answers, but you are not sure about the correct ones. So let's here take an example. We have a 35 years old female with a history of migraines, and she is unconscious with bradycardia. heart rate is 35, hypotension, she has blood pressure 70/40, and this happened after she has ingested an entire bottle of her medication. The ECG shows that she has a complete AV block, so what is the antidote to be administered? So let's try to rule out the wrong options. So flumanazole, we know from our studying materials that flumanazole is the antidote for benzodiazepines. So that is wrong. It has nothing to do with our situation. Naloxone reverses the opioid toxicity. So again, the patient does not have respiratory depression or meiosis. The symptoms in the case scenario doesn't describe opioid overdose, so naloxone is a wrong option. Octreotide is one of the somatostatin analogs, and these are used for the sulfonylurea-induced hypoglycemia, and it is not relevant here. So the only remaining option is glucagon, and glucagon is the specific antidote for the beta blocker overdose, and these symptoms in the case scenario, the bradycardia, the hypotension, this is a symptom. This is the symptoms of beta blockers overdose because it activates the adenylate cyclase via the glucagon receptor, which is the G protein coupled to the same signaling pathway as the beta blockers, and thereby increasing the cyclic AMP. And by this bypassing, we bypass the beta blocker receptors, and we provide positive inotropic and chronotropic effects. And that's why glucagon is the only right answer. And the typical dose is 5 to 10 milligrams IV, followed by continuous infusion. See how eliminating the wrong options here has led to the final answer. So now we move to the third and the final part of our lecture. And in this section, we will cover the country-specific question analysis and see how, again, the elimination technique can work in different contexts. And we will provide some final tips. So let's proceed. Here we have, again, let's try to eliminate, to apply the elimination strategy to this specific question. We have here a specific question about a supplement that increases the INR. Okay, so the scenario involves a strange herb called dongi kwai. So this dongi kwai supposedly increases the INR, but let's say you don't know that the dongi kwai is increasing the INR, but you know from your studying material is that we have the mnemonic go CVS for herbs that decrease the INR. So you know this piece of information from your studying lecture notes. So the go CVS, the G stands for garlic, ginger, ginkgo, ginseng, and the O stands for omega and onion, and the C stands for the CoQ10 enzyme, and the V stands for vitamin K, and the S for St. John worts and so on. So since soy and St. John worts and green tea, all of these decrease INR, you will eliminate them. And then the remaining question, the remaining answer or the remaining option is dongi kwai. So that means it must be the answer. So again, as you can see, you don't need to know what dongi kwai is. You just need to eliminate other wrong options, and that will guide you to the right answer. So here, let's take another example of the elimination technique. We have a patient with common cold, and he is seeking a zinc supplement, and you are asked for the best counseling advice. So eliminating the wrong options would guide you again to the answer. So let's think together. Is zinc contraindicated? Is zinc really contraindicated in cardiovascular? The answer is no. Zinc is safe, so we eliminate that option. Option B says the zinc is contraindicated in hypertension. Again, this is wrong, so we eliminate it. Option C says that we avoid the zinc in case because it possesses long-term complications. Again, this is incorrect. So the only correct answer left is that zinc, if it is started within 24 to 48 hours, it decreases both the severity and the duration of the common cold, and this is the best evidence-based advice in this case. Again, let's take another example from the non-pharma part. Let's look at a patient counseling case. We have Mr. B. He is a 55 years old patient with type 2 diabetes. He's prescribed insulin, and he skips the doses because he is afraid of gaining weight. And his HbA1c is 12%, and this 12% is dangerously high. So what should the pharmacist do? And then we have multiple options. We should eliminate the clearly wrong answer. So one of the clearly wrong answers is that refer to physician to decrease the dose. This is illogical. How can the HbA1c be sky roof at 12 and then you tell him to decrease the dose? Absolutely not. So is it okay to tell him to skip the doses? Again, this is completely wrong. This is one of the medical misdirections, and it would be harmful to the patient. So the only correct answer left is that we want to change his belief about insulin and clearly explain to him the benefits of insulin as it lowers the HbA1c and prevents the neuropathy and the nephropathy complications, and address his fear and dispel the belief that insulin causes unmanageable weight gain. So we have to fully disclose the pros and cons and tell him, yes, insulin might make you gain a little bit weight, but this is manageable with playing sports, and with the proper diet, you can overcome this weight gain. And the benefits of controlling the HbA1c outweighs any side effects, and you can manage the whole thing with the diet and the exercise. So you have to dispel his disbelief that insulin is evil drug that causes unmanageable weight gain, and you have to clearly explain the benefits. So let's move to another country-specific question, and this is important particularly for the Abu Dhabi exam takers. So what is the most important information a patient prescribed fentanyl transdermal patch should know? So what is the most important counseling point regarding patients using fentanyl transdermal patch? So again, here we want to eliminate the wrong answers, such as rotating sites to avoid tolerance, because no, this is not one of the primary concerns. Also, storing the fentanyl patches in the refrigerator doesn't make any sense. Applying heat to improve absorption is again a very dangerous and wrong direction, because applying heat can increase the rate of absorption and it can lead to fatal overdose on fentanyl patches. So the only left correct answer is that we want to avoid increasing the body core temperature. Do not take hot showers or hot baths before applying the fentanyl patches, and do not use heating pads over the application site, because this prevents the fentanyl overdose, and this is the most critical counseling point for this particular medication. So let's move to another example. How can age can completely change the answer? So here we have a parents of a child with upper respiratory tract infection, and these parents are asking you if their child can receive the MMR vaccine, and the child was treated with amoxicillin plus prednisolone for 5 days. So let's break through this question. First of all, amoxicillin does not prevent the MMR vaccination. Secondly, a short course of prednisolone, as short as 5 days, does not actually prevent the MMR vaccination either. And the trap here is to just pay attention to the child's age. So if the child age in this case scenario is 4 years old, that means you can give the vaccine safely now. And if the child is 9 months old, you have to tell the patient that they must delay the vaccination until their child grows 1 year of age. So failing to notice the age can actually lead you to an incorrect answer. Even if you know the drug interactions perfectly, this kind of very delicate detail in the exam can change how you choose the right answer. So lastly, I would like to tell you that you have to consider the psychological preparation. It is as important as the academic preparation. So staying calm and maintaining focus and getting adequate sleep. I can't emphasize this enough. Getting adequate sleep is really, really important, because I have seen highly intelligent students who studied extensively before they entered the exam, but they didn't sleep well and they didn't manage their stress, and they begin to answer even the easiest questions wrongly due to the panic. So try to maintain calmness, get enough sleep before the exam test. Secondly, train yourself through the time-managed mock exams, because that builds your psychological confidence. And always answer every single question. There is no negative marking, so never leave a question blank. If you are stuck, use logic, use intuition, or even guessing, but never leave any question blank. So one of the common pitfalls or mistakes is relying exclusively on the past papers and in the previous exams. And while the older exams from 2021 to 2024 feature heavily repeated questions, the current exams do not work this way. So candidates taking the Qatar exam who only study past papers are currently experience high failure rates because the Qatar has updated its curriculum, as we explained. And what you need is a comprehensive curriculum and looking into all the questions to understand the style. And you need also to follow the updated questions to stay up to date, and you do not rely on the past papers alone. So what about the study groups? The WhatsApp or the Telegram studying groups, these are double-edged swords. And the benefit is that they are excellent for tracking the newest, the most recently reported exam questions from candidates who just tested. However, the danger is that they often circulate questions with wrong answers provided by unverified users. And a candidate might read the wrong answer, become confused, and they ultimately choose the wrong answer on their actual exam. So use the study groups wisely. Just use it as a support system, and you have to verify any information you find there against your primary source materials. Again, I can't emphasize enough about the high-yield topics. The key topics that consistently appear in the exam include the autonomic nervous system, the anesthesia, the dermatology, the pharmacognosy. However, you must study information strictly in proportion to its weight in your Prometric exam, not as if you are studying for a university degree. For example, as we said, in the Saudi Arabia exam, the SPLE, they focus on the cardiovascular system, and the autonomic nervous system, on the other hand, or the dermatology, they feature only 2 to 3 questions. And you do not read endless pages on the autonomic nervous system for the sake of 2 questions. You focus your effort proportionally, and you focus on the cardiovascular and CNS instead. Now, how about the self-study path? People who like to study on their own. It is actually entirely possible to take this self-study path and achieve a high score, and many of our colleagues on the WhatsApp groups have done this successfully. So the question is how to start such pathway. You have to first contact Prodemy via the WhatsApp to receive the free foundational PDF files to begin your studies, and then you can use the WhatsApp groups to track the updates and join our Prodemy platform to get access to mock exam. We have free mock exams which will train you on the real exam situation. However, you have to be aware of the drawbacks. This path requires significantly more time and more effort, and you can have the risk of studying incorrect answers or circulating incorrect information, and you will have to spend extra time reaching the scientific sources to verify the answers. On the other hand, we offer you a formal Prodemy course. And here how it works, we have 2 options. We have the standard or the normal course spread over 45 days, and we have intensive condensed course or the fast track course, which features the whole material in 23 days. And the methodology is in 5 steps. The first step is that you are added to an exclusive WhatsApp group and you receive a customized schedule. And the second step is that you receive updated, organized, and scientifically verified PDF sources. And you can print the PDF and watch the recorded explanation lecture video along with studying the lectures. And the recorded video lectures focuses on the exam relevant points. And the fourth thing is that you move to the Prodemy application, which contains extensive quizzes with detailed scientific explanations about each chapter and about each topic. And lastly, we have a dedicated follow-up team that monitors your progress and identify your weak points. Now, after completing the foundational course, whether you choose the fast track intensive course or the normal path, we have specific additions that are provided for candidates taking target country exams. For example, for Qatar and Oman exam, they receive 1 additional highly targeted lecture and corresponding PDFs and quizzes specific to the recent updates. And for Abu Dhabi exam takers, they receive immense focus with 15 exclusive revision lectures that is managed by a dedicated instructor with a follow-up team. So Prodemy Academy actually has an exclusive PDF for Abu Dhabi exam, and it contains 100% specific content, and it is literally the exam. So one of the warnings, you have to bear in mind that the Abu Dhabi intensive course, which is around 15 days, this one is only indicated for candidates who have already strong foundation. On the other hand, all other countries, they require completing the core curriculum first, and you do not skip the core foundation scientific material. So a final advice on the study methodology here is that think of your preparation like you are building a house. The foundation is the core curriculum, and this is mandatory for everyone, regardless your country. And the pillar subjects demonstrate your specialization in each area, and the roof is the country-specific add-ons. So you do not deceive yourself into thinking that you can skip the foundation and you jump straight into the revision lecture. You must build your foundation first. And we would like to announce that we also have a private one-to-one tutoring through Zoom meetings, and this is one of the available options. And they are limited to a maximum of 2 candidates per session, and it is managed by a dedicated academic instructors. So all links for the free materials and course registration are available through the WhatsApp and through this QR code. And if you found this lecture valuable, please share it with your colleagues who are also preparing for your Prometric exam. And I invite you to kindly write your feedback about this lecture in the chat box. Thank you for your time, and I wish you luck. And don't forget to join us on the Prodemy channel, and we are here to support you in every step of the way.